The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another issue of The Genuine Article, and I have the opportunity of talking to Dr. Nihar Desai, who's a member and working with the TIMI group in Boston, Massachusetts. And they've got kind of a very interesting observation in a paper published in a recent issue of JACC regarding Clopidogrel and its interaction with smoking cigarettes. Can you tell me what made you look at this relationship?
Yeah, it's, well, first I would just say that the adverse health impact of smoking is well recognized, and we certainly don't want this paper to be construed as advocating cigarette smoking. With that said, we wanted to examine whether cigarette smoking could modulate the efficacy of Clopidogrel, and there is a background that sort of this question emanated from. There is substantial variability, inter-individual variability in the response to Clopidogrel, and some of that may derive from the metabolism. It's important to remember that Clopidogrel is a prodrug, which requires a two-step hepatic activation mediated by the P450 enzyme system. CYP1A2, that isoenzyme in particular, is involved in the first step of Clopidogrel activation. It's been well documented that cigarette smoking induces CYP1A2 and therefore is potentially capable of affecting the pharmacokinetics and pharmacodynamics of Clopidogrel.
So you set out to examine whether or not there was an interaction between patients who smoked cigarettes and those who did not in terms of the efficacy of Clopidogrel.
Correct. And in fact, there was a paper published in JACC just several months ago by Blyden et al., which showed that smokers of greater than 10 cigarettes per day actually had greater levels of platelet inhibition and lower platelet aggregation as compared to non-smokers or even smokers of less than 10 cigarettes per day. So this, our study, we feel, actually extends that work to show that this interaction between smoking and the metabolism of Clopidogrel not only affects platelet aggregation, but actually has important clinical consequences.
And what were those consequences?
So we found that smokers of greater than 10 cigarettes per day had improved angiographic and clinical outcomes in Clarity TIMI 28, a randomized trial of patients with ST elevation MI comparing Clopidogrel to placebo. In fact, that interaction, that effect modification from cigarette smoking to Clopidogrel was consistent both for the primary efficacy endpoint, a triple composite of TIMI flow grade 0-1, cardiovascular death, or recurrent MI prior to angiography, as well as the 30-day clinical endpoint, which was a three-way composite of cardiovascular death, myocardial infarction, or recurrent ischemia leading to urgent revascularization.
Okay, well, I can think of three possible take-home messages from this. One is to begin smoking, and we don't want anybody to do that.
We would agree with that.
The second one is that potentially we have a target here in the P450 system to enhance the efficacy of Clopidogrel. And the third is, should we consider altering our dosing in patients who smoke when we use Clopidogrel?
Yeah, I think you've hit on two of the really key takeaways from this. First, that it's important to appreciate that there is that common genetic, environmental, and clinical factors can have important consequences in terms of affecting the metabolism of Clopidogrel, which could translate into variability in response to the medication as well as clinical events. And in fact, in recent months, we've seen analyses for polymorphisms in the P450 system, drug-drug interactions with proton pump inhibitors and calcium channel blockers, and now from our analysis, that cigarette smoking. So all of these daily common genetic, clinical, or environmental factors can actually have important clinical consequences. And secondly, I think that this highlights the potential utility of using platelet function testing to tailor dosing of antiplatelet agents.
Well, these are important lessons from a kind of unexpected relationship of the benefit of cigarette smoking. Thanks very much for being with us.
Thank you.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.